As a PA or an NP, are you looking for that rare opportunity that lets you walk away from clinical medicine, either part-time or walk away from it completely, but that still lets you have an impact in patients' lives and doesn't require you to go out and get any kind of new degree or have to get some kind of certification to do? And you don't have to have a supervising or collaborative position in order to be able to do it. Well, today I'm bringing you an opportunity that hits all those check marks. What I'm talking about is being a patient advocate. You are not in charge of their health. You are not diagnosing them, treating them, prescribing medications. You are there more as an educator and somebody to help them through the system. So if you're intrigued and you want to hear more about this, then please stay tuned. Hey, it's Michelle with the Medicine Couch, and I love this opportunity today. It fits perfectly with what my channel is about, helping PAs and NPs understand all of the different possibilities open to us to help you really craft a career and a life that you enjoy. If you like what I do and you want to help support the channel, then please hit that subscribe button, hit that thumbs up button, and leave a comment down below in the comment section. Now let's get into this interview and learn about how you could become a patient advocate.
I'm Jennifer Whalen, and I graduated PA school in 2004 and then started working clinically right after that.
And what areas of medicine did you work in? Like, what's the general path of your career been?
So, like any good PA, and I'm being sarcastic, of course, I started working in family practice right after school in a rural area in Illinois. Did that for a few years and then worked in urgent care on and off, did a very brief stint in neurointervention, and then worked in hospital medicine for a few years.
Oh, okay. So what are you doing now? Are you still practicing clinically?
I'm not. So I actually stopped practicing about 8 years ago for life transition reasons and just for my family's benefit. I stopped working clinically and I got another degree. I went back and got a doctorate of health sciences and kind of stumbled upon this new path that I'm doing now.
And so what is the title? What is it that you're doing now?
So I actually started working as an independent patient advocate. I was hired by a nurse who trained me, and I am a board certified patient advocate. And actually, what I'm doing now is training people to practice independently and open up their own patient advocacy businesses.
Let's define actually what a patient advocate is.
Sure. So I do want to clarify when all the talking that I do, I am talking about independent patient advocates. So we probably know as medical providers of patient advocates in the hospital or patient advocates that are employed by insurance company. That's not what I'm talking about here. These are people who are independent from that. They don't have an obligation to a business or organization that they have to keep their best interests in mind. They're solely focused on the patient who is their client. So, the independent patient advocate is someone who assists their clients in any needs that they have surrounding the healthcare system. It could be, finding resources. It could be getting a second opinion. It could be communication and collaboration with their medical providers, going to doctor's appointments, talking with insurance companies, explaining a bill, doing an insurance appeal. There's so much that a patient advocate can do, empowering their client, because a lot of what we do is education for our clients. And I think that is important that we can take over and do a lot of things, but helping them understand the system is the best way to, help them long
Yeah.
term.
How does it actually look? Like, are you going to their homes? Are you looking through their bills? Like how
Yep.
get specific?
Yeah. So just right off the bat, this independent patient advocacy relationship with our clients is very intimate. So we are going to their homes. We're going with them to their doctor's appointments. We can go to the hospital with them. We get to know their families very well. Those are options for how patient advocacy can work. And that's what it looks like in most instances. The patient, or oftentimes it's a family member, will call the advocate and say, I'm just struggling. We have this new diagnosis and they want us to do all these tests and I don't know what's going on and I need some help. So it's really, they're in a situation, an urgent, oftentimes situation, and they need someone to step in and just help them, guide them through this process. A lot of times we'll also see children of seniors, they come visit their parents for Thanksgiving or holiday or something, and they're like, mom is not cognitively the way she used to be. And this is concerning, but I live across the country and I need someone to kind of step in and tell me what's going on, go to the doctor's appointments with her, get a diagnosis, see if there's treatment, is she safe in the home, do we need to make a transition of her, living situation. So it really runs the gamut of what we see. Sometimes we get a call from family members of patients who are in the hospital, they're in the ICU. I have no idea what's going on. The doctors aren't talking to me. I need to be making some decisions and I don't understand what they're saying. So we'll get those types of calls too. People are going to pay you a good amount of money because they are really needing some help.
And I imagine that PAs and NPs are perfectly suited for this because we can really understand what the doctor or the healthcare provider is telling the patient and the family and help steer them. Obviously, I assume that you are not making any treatment decisions for the patient or anything, correct?
Exactly. And I want to make that clear because there are some things that we, as independent advocates, that we live by. We're not telling anyone what to do. We're not making any medical decisions for you. We usually don't get involved. We don't get involved in any litigation. So we don't do anything hands-on, even if we have the credentials to do so. I'm not going to someone's house and inserting an IV. We're not practicing under our licenses. We're not doing anything that a layperson couldn't do, if that makes any sense. Someone without a license or
Yeah.
without that training.
Right. So it's just educating the patient and taking the words, the medical words, and helping them understand a little bit more,
Yeah.
which is unfortunate that it really is unfortunate that we have to have this kind of position, right? I mean, the way it should
Mm-hmm.
work is that the provider should have time to be able to work with the patient and explain it and take as long as they need to make sure the patient is comfortable and understands it. But we all know that's not how medicine works nowadays.
Right. I mean, definitely we're there to provide that space for them that sometimes we're so rushed through the healthcare system and you need to be making a decision and we're going to do this and you should have this surgery. It's like, you know what? You can take a minute and breathe. And,
Right.
we're going to talk about it. Let's get your family together. You should feel comfortable with the decisions that you're making. One of the things is, as medical professionals, we will see errors and things that we have questions about. It's like, oh my gosh, why did they prescribe these two of the exact same medication? They really shouldn't be on these two blood thinners at the same time. That must have been an error somewhere. So then you say, just to let you know, these are two blood thinners that do the exact same thing. And it might be worth a conversation with your physician, a call to your physician, about why you're taking this. So we're not telling them what to do.
Right.
We're always going back to the prescriber, the provider. They are the ultimate authorities. But of course you're going to notice, those things when
Yeah.
you're working with clients. And we just try to do it in such a way that we're bringing information to their attention, but we're not telling them what to do.
I understand like how providers are perfectly suited to do the look at the medicine side of things, but I assume, and you mentioned earlier, that patients sometimes want your help kind of navigating the insurance side. So is that something that you're doing, like looking at their insurance policy or looking at their EOBs and trying to kind of
Yeah.
explain to them things?
So independent advocates absolutely have to have knowledge of insurance. Medicare, absolutely. Private insurance, state funded plans, Affordable Care Act, absolutely. Or they need to know who are their experts in that. And there are expert patient advocates who that's their sole focus is insurance appeals, that type of thing. And you can go to them. That's not my area of expertise. I'm a generalist advocate, but if I have someone, client that comes to me and that's their only issue and need, I'm going to say, I can do it. It might take me a little more effort and time to work through it. But what I really think is you need to go see my friend, whoever it is, and they can help, they can serve you more efficiently. And that's what advocates do.
Yeah.
We refer to our other advocates very frequently. But no, you need to have an understanding of insurance. Do you have to make that your sole focus of your business and be an expert in it? Absolutely not.
How do people learn how to do this? You said there are training programs that people can find online. Is that correct?
There are training programs out there. There are colleges, universities who offer kind of certificate programs. Now, they're not comprehensive generally. They're more about the theory of patient advocacy. But then there are independent programs that kind of combine all that theory, the practical aspects, and the most important thing, especially for medical professionals who are going into this, is how do you start a business, right? Because you have to be a little bit of an entrepreneur. You just have to figure out the business side of things. And that's, I think, probably the most important aspect for medical professionals who are jumping into this. They have the medical training. They usually know, how the system works. It's like, yeah, but how do I start my business and put myself out there and let people know this is what I'm doing?
Yeah. If a PA or NP is looking at doing this, there's not companies that are hiring PAs or NPs to be a patient advocate, is there? Or is it all on their own?
There are companies that are hiring
Okay.
PAs and NPs. So I think most of what we're seeing is our solo practices right now. Most people want their own business because it's something that they build and they have that for the future. They can sell it, they can hire employees, contractors, and that's what they want to do. They don't want someone telling them what to do or what hours to work. So that's, why independent businesses are so appealing. But we have very successful advocates out there. They're employing 10 nurses or nurse practitioners, PAs, whoever it is. And so it is something that if someone had an interest in this and they're like, I just don't want to start my own business, but I would love to go see clients and go to the doctor's appointments with them. And you can absolutely do contract work and help these people who do have their solo businesses. So I'm in Arizona and we have, I don't know, maybe 30 advocates practicing in the state. And the advocates cannot see all the clients that they need to see. They are having to turn people away and refer to other advocates because they're so busy. And they are looking for that person who can kind of jump in and help see the clients for them.
It sounds like there's some different options there, but let's talk about the fees and like how much money you can make. Is this something that if somebody, a PA or NP, wanted to step away from clinical business and start becoming a patient advocate, is this something that they could make enough to replace their PA or NP income?
They could, and it probably wouldn't be right away. It might take a year or two to kind of build their business and their client base and their referral kind of pipeline that they'll have. But it is something that they could replace their income with eventually. And it might look a little bit different. It might include that they're going to have to hire people to help them, maybe admin or other nurses or PAs, doctors, whoever it is, to help them grow that business.
So you're saying that basically there's an amount of money you can make, but to really ramp it up to kind of replace a PA or NP income, we would likely need to employ others who are also bringing in money to your business, right? And that's kind of an interesting point when you said it can be, nurses, PAs, NPs, different people. So you have a big pool of people you could draw from, but I assume that you also could have in your business somebody who is just your insurance person, and they wouldn't even have to be clinical. They could have been somebody who was working in billing in a medical office or something, right? So there's lots of different people that you could bring into your team that maybe you wouldn't have to pay as much as you would for a provider.
Absolutely.
How do patients pay for this service? Is any of it covered by insurance, or is it just out of pocket?
It is not covered by insurance and it's out of pocket. It's primarily private pay. And a little bit of that is because if it were covered by insurance, again, then we'd be obligated to the insurance company for time spent with the client, documentation, and of course they would put parameters on what you could be doing, what you should be doing, what providers you should be utilizing, all of that. And that's probably not the route that independent patient advocates want to go. And I'll tell you, independent patient advocates charge kind of like lawyers do. So most of them, almost all of them, I would say, it's a retainer type system and then billing, down from there. So in Arizona, advocates charge from $150 to $200 an hour on average, and it does vary from there. And we have mostly nurses who are working as advocates, but social workers, doctors, people without, medical degrees also are doing this here and are very successful with it. But probably physician assistants, physician associates now, and nurse practitioners are charging probably $250 an hour and upwards for their services. So you kind of can take those numbers and then go from there on how many hours are you going to bill per week? How many hours do you have to devote to working the business that you're actually not going to be able to bill for? And then kind of come up with an idea of, can you replace your income at what point
Right.
in time?
So when you look at it from the patient side, though, I mean, that seems like a lot of money to pay when you're already having to pay all of the money in that the healthcare system itself costs. So does that mean that most of the patients that you work with are like fairly well off financially?
Not necessarily. Definitely, there needs to be someone who can, pay these fees somehow. Our clients run the gamut from people who are on a fixed income. There are older, clients who are on Medicare. We absolutely have clients who are on Medicaid state-funded programs who utilize the Affordable Care Act. So we do have people who maybe themselves are not able to pay, but a family member, a friend, someone who notices they really need these services and we see the value in these services and we're absolutely willing to pay. There are starting to be some scholarship and grant programs where if you do have a client who can't afford your services, they'll be able to supply some or all of the funding for your services, maybe up to a certain number of hours, that type of thing. So we recognize the need for that as well. And of course, we want to be able to serve anyone who has this need, but it's still, we are an emerging profession and kind of building up that system where we have that financial backing built in it's a goal.
I imagine that there might be times that you can also, through educating them, save them more money, like if they had to go back to their provider because they didn't understand or had some complication that if you educated them about they could have avoided. I assume that happens too, right?
Absolutely. And I really would love to get some data on this at some point in time is, how much are we saving them financially in the long run? Because then they don't have to get an extra test or see another provider or, oh, we actually got that covered by insurance instead of you paying for it out of pocket, or we got you on a patient assistance program for that medication. Why are you paying that much money? There's so much that an advocate knows and that they have in their back pocket that they can save people a lot of money and a lot of time. I mean, just the resources, things we can refer people to programs that have resources that they didn't even know about.
Right.
It's like, oh wow, I can have someone come to my house and they're going to do this and it's free based on this, whatever program.
Yeah.
I mean, there's so much out there that the average person doesn't know about that really could save them a lot of money.
I just was thinking about how many times, like in family practice, that you tell somebody about a program that exists out there or a society that has something that they can help the person with, but you kind of know when they walk out the door 9 times out of 10, those people are not going to even look into that because they don't know anything about it and it just seems like it's too difficult. But, being a patient advocate, especially imagine after you do this for a while and you start finding those resources and gathering them, that you can really help people through that process of applying for those programs as well.
Absolutely. I mean, it can be daunting for people to have to then go back and call that place. Well, I don't know. My doctor said this and I didn't really understand. And do I need this? And maybe they're not telling their doctor the right information. They're not telling, whatever that program is, the right information. They just don't do it. Whereas the advocate is like, all right, I'm going to make this call for you. Are you okay with that? And gets it set up and going. And it just makes things, because we really are that transition between what happens in healthcare and what's happening at home.
Is there like a certification or something out there that people could get to attach to their name to prove that they know what they're doing basically?
Yeah, so there is a certification. It's through the Patient Advocate Certification Board. And then if you pass, you're able to use the BCPA credential, so Board Certified Patient Advocate credential.
Do you have to be certified to go and start this business?
It's great to be board certified, absolutely not a requirement. And the public does not know what a board certified patient advocate is right now. And there's no licensing in states for advocates either.
And do you have to carry malpractice insurance?
You do. Yeah, some type of errors and omissions insurance.
And I assume since you're not practicing medicine that you don't have to have a supervising physician or anything to do this, correct?
No.
So there's no conflict of interest, like if somebody worked as a PA or an NP part-time, but they wanted to do this also part-time, can you still be a practicing provider and do this? Or any conflict of interest there?
No, have to disclose what you do in your other business and make sure that your clients know that there's no pressure to utilize that organization or that business's services. But we absolutely have practicing NPs and PAs out there who are also doing independent advocacy on the side, and they do
Yeah.
it well.
Okay. And I'm wondering when you go to a doctor's appointment with a patient, have you noticed any kind of like negative feelings to you being there? Did the people, medical providers, sometimes feel threatened or not like that you're there?
No, absolutely not. And that's because we're there supporting everyone. I mean, advocates actually provide a lot of benefit to the medical providers as well. I mean, just imagine that you are working as a PA and you're seeing an elderly client and they walk in with their advocate and the advocate hands you an accurate, up to date medication list with all of the prescribers on there and where they're getting it. They hand you copies of all of their advanced directives. They hand you what the last specialist said, and these were the recommendations, and this is what we're doing. And how much, that's a lot of work that
Yeah.
they don't have to do. Advocates are not confrontational with medical providers whatsoever. We're there to facilitate collaboration and communication. And oftentimes the provider is like, you know what, here's my cell phone, just text me when X, Y, and Z. We start to build these really close relationships with the providers too.
And I also was thinking too, how great would it be to have somebody there who could keep the patient focused on why they're there and make sure that they mention all of the pertinent things that, because I imagine you meet with the patient a little bit ahead of time before the appointment and to make sure
Exactly.
that you know what they're going to this appointment for and what they need to mention.
Exactly. And even if you're not going, the advocate's not going to the appointment, maybe the daughter is or a friend is. So you're prepping like, okay, these are the questions. These are the questions that we need to get answered. What do you want to know? Prep that, prepare it in a document. They could even hand it to the physician, and it just makes things smoother in the long run.
What do you love about being a patient advocate?
I think it's just such a rewarding career because you do build those strong relationships with your clients and their families and caregivers. And you can see often over the long term years how you've helped that family. As advocates, we might not always change the outcome. Patients still die, things happen, but we change the experience for them. And so we give them that sense of like, and especially family members, did I do everything I could for my dad in this situation? Did we explore everything? And it just gives that sense that they're not going to have regret later on.
You're giving them peace of mind, right?
100%, 100%. It's peace of mind. Absolutely. Absolutely.
Yeah.
Just taking away that fear, desperation, confusion. That's a wonderful thing.
I was thinking about like my favorite parts of working in family practice, or even I worked as a hospitalist for a little while, is explaining things to people and helping them really understand, what the state of their health is or what things they have control over. And those are the things that you never have enough time to do when you're practicing. For people like us who enjoy that part of the patient interaction, it lets you do that without having the stress of actually being in charge of their health and being the person making the decisions and not having the time to talk to them as much as you want. So I see how it takes a lot of the good parts of medicine and lets you just practice it how you want.
Yeah, absolutely. Absolutely. I love that you can give them back control, right? It's really heartwarming. It's just so nice. And you feel the love from your clients and their family. They're always thanking you and, oh, I appreciate you so much. And it feels really nice.
Nothing is ever all roses and puppy dogs. So what are some of the challenges and the downsides that people need to think about or be prepared for if they're going to look into doing this?
There's a lot. Owning your own business, there can be some ups and downs with it. Fortunately, starting an independent patient advocacy business, it's not a huge overhead. There's not a huge financial investment that you have to do. I mean, there's some things, but it's really not crazy. But it is getting those clients, and you kind of have to work, in a strategic manner to get those clients in the beginning. And then after that, it's usually advocates go through a phase of then they have a lot of clients. And then what do I do? right? I don't have enough time to see all these clients, but I'd love to be able to help them. And I'd love the, financial benefit from seeing them. And it's the growth.
I would think that a challenge for me, and I'm sure other people must face this, would be, first of all, keeping track of the actual hours that you are spending with a patient, because you have to do that like attorneys do when you're billing. So if you jump on a phone call with somebody or whatever, you have to make sure that you keep that documented. But the other thing, I would probably feel a little not guilty, because I know you're giving a great service, but I just know my personality. I think that would be hard for me because it's more one-on-one about the money than like when you're practicing medicine. That's the practice is going to be billing you, or your insurance is going to be billing you. I don't deal with that. So somebody would, I assume, would have to be more confident about that, and be comfortable with talking about money and fees with clients.
100%. It's very uncomfortable for new advocates, and that's one of the things that we work with them on, is that you bring so much value to the table. You're not hiding anything from anyone. You're completely honest with what your fees are and how you're billing. Every time I'm doing work for you, I'm charging you $200 an hour, and I bill in 15-minute increments or whatever it is. But you're charging, if you're doing extensive texting with them during the day, emails, phone calls, you name it, you are absolutely keeping track of that, and you have to make it a habit. The end of every day, I'm putting in, my invoices, I'm writing it down somehow, what I did for work for those clients.
Yeah.
Now, of course, you're going to be fair. Of course, if you go to the doctor's appointment and you're sitting in the waiting room with them for 2 hours, but yet you brought your laptop and you're doing some other work, you're not going to bill them for that time. And you can say, yes, we were at the doctor's appointment for 4 hours. You're going to bill them for an hour and a half or 2 hours or something, like that. But it is a hurdle. People are absolutely afraid. Well, I think I'm just going to charge $75 because I'm not sure. It's like, nope. You're going to very quickly, once you get into it and start seeing clients and you know the value of what you're bringing, that changes.
Yeah.
Like, oh yeah,
Yeah.
I really should have started off at 150 an hour. But it is hard.
Yeah.
It's a mindset change. I talk about
Right.
the patient advocate mindset, and it's different than a medical provider.
What do you see for the future as far as patient advocates go? Do you think it's going to become a booming sector?
I do. I mean, there's been so much growth in the field already. We have multiple organizations, nonprofit, for profit, that are growing. We're having national conferences every year now. State organizations are popping up. We're starting to see the organization of this profession. And I just think the healthcare system is not getting any easier for people. It's not getting any cheaper.
I'll put some links down below to different organizations and things that people can check out if they want more information about it. Well, thank you so much, Jennifer, for sharing all this fabulous information.
Yeah, absolutely. Thank you so much for having me, Michelle. Appreciate it.
If this isn't what you're looking for, but you would still like to find opportunities for non-clinical roles in medicine, then check out this playlist here. Don't forget, on my main channel page, you can check out all the different playlists I have, from PAs doing cool and unusual things to those working all around the world. Thanks for joining me today, and as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.